So, good morning, ma'am. I'm Aiza Luis Alvarez from BSN 1 M4A. Today, I will demonstrate the proper procedure for giving a bed bath. The objective of this procedure is to maintain the patient hygiene, comfort, skin integrity while ensuring the patient's safety, privacy, and dignity. First, I will check the patient chart for any limitation on physical activity. Then, I will gather the necessary equipment and place them at the bedside, such as the water, the soap, the washcloth, the hot blanket, the towel, as well as the patient personal hygiene. Then I will perform hand hygiene and wear PPE if indicated. Now I will be identifying the patient. So, good morning, ma'am. I'm Aizel, your student nurse from Our Lady of Fatima University. So, may you please ask for your full name and your date of birth?
My full name is Sabel Doreen Alvarez and I was born in February 10, 2009.
Okay, so for today, ma'am, I will be giving you a bed bath. May I please ask for your consent?
Okay.
Okay, so after that, I will close the door or the curtain and adjust the room temperature if needed. Then, I will be removing any anti-embolism stocking or compression device, according to facility policy. Then, before starting the bed bath, I will ask the patient if she would like to use a urinal or bed pan. So, ma'am, would you like to use a urinal or bed pan?
No.
So, if the patient agreed to use a urinal, you have to wear gloves and handle the urinal or bed pan. And after handling those, you have to remove your gloves and perform hand hygiene again. Now, I will be adjusting the bed of the patient to a comfortable working height, usually below the elbow of the caregiver. I will lower the side rails and position the patient comfortably. Now, I will put a mud blanket over the patient. And remove the top sheet over the patient while maintaining the coverage. Ma'am, can you please hold this? Then, I will help the patient remove the gown. While keeping the bed pads in place for privacy. After that, for the patient's safety, I will raise the side rails, prepare the water and the washcloths. But first, I will wear a gloves. Then, I will fold the washcloth like that. I will apply emulsion if needed. Then, I will wash the patient eyes first from inner to outer counters using the different side of the washcloth. So, can you please close your eyes? Then, I will wash the patient face, neck, ears, now I will place a towel under the patient's arm fold it lengthwise. I will wash the patient's hand first, arm, and the axillary. The axillary. Then I will soak the patient's hand. And dry the patient's hands. Now, I will move the towel and repeat the same procedure on the other arm. And the axillary as well. Then I will soak the hands as well. Can you please soak your hand here, Max? Okay. Then dry the hands. Now I will be placing a towel on the patient's chest to keep the patient warm, as we will be washing the patient's chest. We will gently expose the patient's chest while keeping the other parts of the body covered. We will wash the patient's chest and especially the skin folds. After that, we will also wash the patient's abdomen. And please hold this now. We will wash the patient's abdomen, especially the umbilical part. Then, we keep the patient covered. Then, I will place a towel on the patient, below the patient's feet, and fold it again lengthwise. I will gently expose the patient's legs. Can you please raise your legs? Then I will wash the patient's legs, going from ankle to groin, using a long firm stroke, as well as the patient's feet and toes. We will repeat the procedure on the other part of the leg. Then we will change the We will ensure that the patient is covered, and then we will change the water and the washcloth if needed. Then I will assist the patient into a side lie position. This side. Now I will gently expose the patient's back so that I can wash the patient's back and buttocks. First, the patient's back. So I will wash the patient's back as well as the patient's buttocks. Then I will prepare for perineal care. So I will prepare for perineal care. So I will change the contaminated water and washcloths, and I will remove my gloves. And wear a clean one. Then I will ask the patient to bend his knees, bend your knees, and spread your legs. So we will be assisting the patient's perineal care by helping the patient of her self-hygiene. We will wipe from cleanest to dirtiest. Then, after that, I will assist the patient in a comfortable position. I will assist the patient to wear a clean lab gown. Can you please wear this for me? And place the blanket of the patient. So now I will assist the patient to his personal care such as the hair. So if necessary, we will be shampooing the patient by using water on his hair and putting in shampoo, wash it and rinse, and then we will groom the patient's hair. Then if the patient would like a back rub, so ma'am, would you like me to give you a gentle massage on the back?
Yes.
Okay, so can you please turn to your side? So we'll be using a emulant if needed. Then apply a gentle massage on the face. Okay. Now for the patient oral care, we will help the patient to brush her teeth and spit on the container. Now after the patient is done with her personal hygiene, we will now place the patient in a comfortable position, lower the bed, raise the handrails, and I will remove my gloves, dispose the dirty linens, and I will perform hand hygiene and remove my PPE. And that's how you give a bed bath to a patient.